Hi, I'm Myra Gamis and welcome to the show. The pandemic has presented many challenges to the education sector and receiving many mental health impact. Joining our discussion today is Mrs. Lala Dapitan Rojas, Guidance Counselor of the Pamantasan ng Lungsod ng Valenzuela. Hello ma'am, welcome to the show.
Hello, good morning. Thank you for having me.
Can you introduce yourself to our viewers?
Hello, I am Lala Dapitan Rojas, and I'm one of the guidance counselors here in Pamantasan ng Lungsod ng Valenzuela. And I've been with the PLV for 3 years, but I've been practicing for almost 5 years now.
Okay. Let's start with the interview.
Sige.
On October 5, over 24 million Filipino students started classes in the middle of pandemic. We've been hearing reading reports of students experiencing burnout. As a guidance counselor, what is the state of the students' mental health during the pandemic?
Actually, in general, we can really see that there's an increase of mental health concerns, especially here in PLV. So we can say that a lot of people, especially the students, have been very affected with the pandemic and the online learning. And given that a lot of changes has happened with their daily living experiences, no, this is very much expected and a natural occurrence during the time of pandemic.
To contextualize our discussion, can you briefly discuss to our viewers what is the symptoms of having anxiety, depression, and stress?
Okay, so stress, anxiety, and depression are different things now, but stress could lead to anxiety and to depression if it's unmanaged. Siguro, if we look at it closely, medyo mahaba yun siya na discussion, but you are able to distinguish if you are having these symptoms, if halimbawa, you have difficulty concentrating, you are unable to manage your performances, no? May agitation, restlessness, you feel like you want to eat more or less, you don't have interest in anything na before you like to do. Also, I'm basically describing yung depression. And there is extreme sadness, hopelessness. Also, if there is a suicidal ideation, so that is depression. For anxiety, hirapan ka huminga, inability to concentrate, the same thing. So you are able to distinguish or to know if you are going through something in your mental health if you look into three things. First is your performance. Performance in school or at work. Kung may inability to cope with the demands. No? Then the second one is your self-care. Are you able to take care of yourselves and with other people? If you cannot find time to just simply enjoy a cup of coffee, mga ganun bagay na you really want to do just so you could relax. If it is not seen in your lifestyle currently, then something is wrong. And then the third one is your relationships. Kumbaga pag nagkakaroon ng problema sa mga relationships mo, then maybe, ayan, you have, something is going on. So tatlo yon. First, performance. Second, self-care. And then third is your relationships. And then maybe you could look into the descriptions or the symptoms of the yung anxiety and depression, no? You can just Google it, but do not, again, this is do not self-diagnose. Yun yung kalimitan natin problema eh. Basta pag na-check natin na, wait lang, parang nahirapan ako mag-sleep at the moment. Baka meron na akong ganito.
Well, they're getting scared po sa mga nababasa nila sa internet.
Yes. Well, actually, the internet is very helpful because mas madali siyang i-access. No? The information can easily be accessed, but do not do self-diagnosis because it takes a professional for you to really say that you have these kinds of mental health concerns, no? So, kumbaga, they could give us an awareness that something is wrong sa atin, but do not magnify the information na nakikita natin, because we might be going through a simple being stuck, no, na situation, not that we are pathological already. So, do not self-diagnose. Ayan lang.
For our next question po, COVID-19 has infected 260,000 people in the country, and of course, there's anxiety comes with this, that whenever one goes out, it seems like this fear of contracting COVID-19, and for students who are doing distance learning now, attending online classes or learning modules, it adds stress. Based on your experience as a guidance counselor, what are the usual concerns of the students whenever they do consultations, especially on these times?
Well, there is an increase in the number of students asking for help in terms of time management. And actually, marami talaga yung pupunta sa office because they are unable already to manage yung nakapile nila na trabaho. So, they would just come actually na sabihin nila they are depressed. No? That's the common thing that they would say. I'm depressed because I'm unable to eat, hindi ako makatulog, I'm extremely sad. But when I look into it, actually, nagkakaroon talaga sila ng problema because ang dami na pala nilang pile up na trabaho, no? Special requirements, ng mga deadlines, hindi nila ma-cope. And the teachers are asking for them na, ito, ipasa mo na. And then sometimes, yung iba, hindi pa talaga nakakapagpasa. And they were past deadline na. So, yun yung mga usual na hinahandle namin ng mga cases at the moment. So, yun.
Yung mga students po na nabanggit nyo, do that students tell you that their environment is not that too conducive when it comes to learning?
Yeah, a lot of them would say na they would prefer face-to-face learning kasi nasanay nga sila na, I mean, everybody naman talaga sanay na face-to-face, no? The usual classroom setup, nahihirapan sila to concentrate because yun, naririnig nila yung tilaok ng manok, may nag-aaway sa kapitbahay, no? The place na, it's very understandable. This is a very natural reaction to a time such as this, that everybody is coping. Everybody is inside the home. We are having restrictions.
No?
Yes, and it's very true. And that is the one thing that most people are, there's an oversight in that area na kailangan talaga nating mag-cope. Although na I'm not saying, no, in my perspective, I'm not saying na I'm limiting or taking a look at that particular issue as something very little, no, na hindi siya serious. It's serious actually, but what I'm trying to say is that everybody has the innate capacity to cope with the changes because that's how we are made. We are made to cope with the changes, and actually we've gone through a lot of changes from birth until now. Kaya lang, eto talaga, this is huge because not only us are experiencing it, not only in our homes, but the world is experiencing it. So, medyo na ma-magnify siya. And everybody's inside the home. You see people or parents and brothers and sisters doing the same thing inside the house. No, meron nagtatrabaho if they're working in the BPO. So, the place where they usually eat, no, or they usually have their me time, yung self-care time, where they watch TV, is the place now that they work. And when I say work for students, that's the place where they learn. So, wala nang lugar for, yung tutulog ka na lang dito sa bed mo because that's the place where you do your homework. So, kumbaga, masakit siya sa ulo. And very understandable then because not only are they facing the online learning setup, but, people, nahihirapan talaga sila because a lot of people has lost their jobs, walang means to survive, may mga sakit, may iba pa dyan nagka-COVID. So, maintindihan mo talaga why people are having difficulty during this time. But again, there's an emphasis on the ability to cope. We have the innate capacity to cope during pandemic or yung normal situation.
Ma'am, during the pandemic, do the consultations increase or decrease when it was compared with the pre-pandemic setup?
Siguro now, I would say say that there's an increase, but it's not a dramatic increase. No? Parang usual pa rin siya. Kaya lang, the concerns are more centered on pandemic issues. Ayun lang. So, the same pa rin. Makikita mo that a lot of people are still unable to siguro share their thoughts or share their feelings to someone they don't know. Or kumbaga siguro there is still stigma, and I could say na very strong pa rin talaga siya yung stigma na yon dito sa pamantasan. Because we see, I have experiences na people would message sa page namin and then magpapakonsult. And then when i-message mo na sila for counseling session, sasabihin na okay na po ako. Ganon. Marami akong experience na gano'n. Magsaset ka na ng schedule, sasabihin nila okay na sila. It's because that's the tendency of humans. No? This is not limited to now. Kumbaga ganun talaga. Yung whenever we feel there's an elevation or parang okay na yung pakiramdam ko at the moment, it seems na, okay na, I can manage it. But then, ano lang pala yun, parang short feeling lang siya. And then, pag bumalik na ulit, mas malaki yung wave ng problema, saka na naman sila lilapit. And the sad part is, sometimes, yung iba, hindi na talaga able to share. Wala na talaga, kumbaga wala nang, makikita mo lang sila during the time na yung logbook na sila. So, yun yung problema talaga now. Again, I would say, there's an increase, but not dramatic. Hindi malaki talaga. And nag-iba lang yung concerns compared to before.
Sabi niyo nga po kanina, di ba lahat tayo naapektuhan nitong pandemic. Lahat ng tao sa bahay natin. Undeniably po, kasama din yung parents. Parents are also affected with these problems we are facing. What do you think? How is the setup affecting the parents?
Well, there is another responsibility that is on their shoulder. Because before the pandemic, their main focus is to manage the home and to provide for the family. And then now, they become supervisors, no? Educational supervisors, no? If there's a term for that. So, kumbaga, they see to it that yung mga estudyante nila are coping well sa pag-aaral. And this is something na hindi talaga nakaatas talaga sa, although, na sabihin natin, second parents lang yung mga teachers, pero most of the time talaga ng mga estudyante is nasa school. Kumbaga, it's not something na iniisip talaga nila everyday, no? But good na pag-college na yung estudyante or senior high school because they're a lot more independent compared to the younger kids or students. Kumbaga, able naman sila to understand yung instructions on their own. But for some parents who have college, senior high school, and then may elementary pa, this is very, this is a huge responsibility for them. No, being a teacher to their kids, and perhaps they're not only thinking about that. Siguro yung iba sa kanila nawala ng trabaho and maghahanap pa ng trabaho, etc., etc. So,
Parang you do not have a choice po, no? Kundi parang i-give up din yung work mo para matutukan yung mga bata.
Well, if you have that kind of luxury, if you have that kind of privilege na, well, that is something na, it's another issue, no? It's an issue of grief. Loss of job, loss of opportunity, or a career perhaps. That is something different. So, add to it, lahat-lahat na, no, during the pandemic, yung fear mo na baka magkasakit ka, you have children to look after to, yung mga bagay na normal and natural na experiences natin. Like ako as a personally, like, ako bilang magulang, kaya ko ba na i-maintain yung health ko because I have kids, no? Lahat yon maraming iniisip. So, definitely affected talaga ang mga parents.
And to contextualize the situation that our students are undergoing now, can we consider the stress or the anxiety that we are experiencing when it comes to distance learning as a factor?
Well, definitely, this is a huge concern, no, for everybody. Facing a pandemic is not easy. You have a lot of reasons to be anxious about something. Kasi nga, you look after your health, your source of income, you look after your children, yung education mo. For students naman, online learning, yes, it could be a source of stress. Again, our house may not be as conducive as it is compared to others, no? Mainit, maulan, yung iba walang internet. Masakit yun sa ulo if you really want to pursue or you really want to perform at school. Mahirap yun. Kumbaga, those are concerns that you don't usually think of kung ikaw ay nasa face-to-face learning. Again, we should not, I would say that this is a big problem, no? We need to focus on it. And on the other side naman is that we have to look into it just as like another concern, because we all go through changes every day, and whenever we face changes, there is always stress, no? Loss of job, kung mayroong bagong baby sa bahay, kung mayroong kang bagong trabaho, or if pumasok ka sa college, no? Lahat ng yun makaka-bring sa atin ng stress. So we should not take stress as something negative, because it could be positive and negative, no? There is what we call eustress and de-stress. So pag eustress, it's a positive stress, meaning it drives you or pushes you to perform into something that is expected at the moment. So pag maging distress siya, no, pag negative stress siya, pag it affects your functioning. So it's the opposite. So pag nahihirapan ka na to perform, instead of performing for a single task, you choose to fly. Deadline ko na bukas, ang dami kong gagawin, so I will not do anything. So that's a negative coping. So pag eustress siya, I have a deadline tomorrow, so I will work on it now. So that's something positive. So kumbaga, we should not siguro look at pinpoint or magnify the issue on online learning, because everybody is going through it, no? And there are people that are going through it and they're able to survive it. So don't look at it negatively, as I may say it, but think about it as something that, as an encouragement, no, that there is a positive aspect in us, an innate capacity in us to cope with anything, be it online learning, be it pandemic, be it any loss that we are going through. So we have that innate capacity because God has made us that way.
Thank you for that, Ma'am. No? So this is another question. If this is based on research, we're facing another issue with regards to a student's mental health, as the Department of Education only has 1,096 active guidance counselor for over 22 million public schools. As a guidance counselor too, what do you think is the implication of the shortage of guidance counselor in addressing the mental health issues of the students?
Of course, it is expected there is also limitation. And there are issues that will not be addressed, no? So, kahit na sabihin natin na for every public school may isa, hindi pa rin kaya. Kasi, ang dami mong i-deal, no? It's not about just talking to students. It's not about that. You have a lot of programs din na iisipin and titingnan. And kahit na mag-focus ka lang sa isang estudyante, sabihin natin you have 6 students a day, that's 30 in a week times 4. So 120 students, and if pamantasan has how many students? 6,000, di talaga kaya in 1 year. So kumbaga may mga mali left out talaga ng mga estudyante. So I hope that with the trust now of the national government regarding guidance counselors, ay ma-push and ma-provide talaga ang guidance counselors sa lahat ng public schools.
Medyo rin, for everyone din, mga information na masasabi dito. there's still this stigma that whenever has to consult a psychiatrist or any mental health professional, how can we break the stigma? What can you say about the issue? Alam niyo po yung pag pupunta yung isang student sa isang psychiatrist or anyone, iisipin agad na ibang tao, i-judge agad sila na meron silang mental health condition. Yung iba nga po hindi tinatawag na ganun, tatawagin sila as baliw. So ano pong
Mm-mm.
masasabi niyo sa issue na yun?
Well, that issue has long been there, no? Kumbaga, kahit na there are efforts to break the stigma, pero mahirap siyang i-battle, especially when ang mindset ng tao ang kalaban mo. So, siguro on our part as helping professionals, there is the responsibility to really educate, to build a that is not guidance counseling or counseling is for, or yung mental health professionals, hindi ganon, no? Hindi ganon yung area talaga na. But we are just here to help, just like any other doctor na, pag may sakit ka, ayun, pupunta ka sa doktor mo. The same way, no? If we feel that something is not necessarily may sakit, but if you see that something is bothering you or not good within you, then you go to someone who is a professional on that area. And also, siguro, would like to encourage people that to really look at it that way, na mental health is a major concern, just like your physical health. And it is a form of self-care, no? God has given us, complex capabilities and strengths, but also we have to acknowledge that there are weaknesses, and being in a community or being in a family na who supports you is something different compared to how you take care of yourself. So we really need people, we really need a community who takes care of us. And for those who have experienced the benefits of counseling, we encourage you to encourage others as well. And to always look at mental health as not something alien to us, because it's part of us being human. Kasi parang siguro the way we think about it, no? Nagkakaroon ng ayun yung stigma nga na medyo sabihin nila may problema ka sa utak, no? We can look at it in a non-pathological way that we are just stuck. Again, we have the capacities for coping in any areas of life. So, ayun. Hopefully, no, na with the efforts that we do for building awareness to people, ay ma-end din naman tong stigma towards mental health.
If anyone, especially students like me who's experiencing anxiety, distress, what should one do? What is the best coping mechanism? Like, what can you advise? What can you advise, ma'am, for us?
Well, if you know that something is, from time to time, it's good that we have some introspections, no? Meron tayo dapat inventory ng self natin. We evaluate ourselves from time to time. Kasi dun minsan na may something na sa akin, sige lang, I just brush it off, no? But later on, we find ourselves in a more difficult situation and mahirapan na tayo na umahon. Because lalo na if we don't ask or seek help from people. Siguro yun, you have to manage yourself well. Una, you exercise, no? Not just focus on screen kasi lahat naman kayo ngayon nakatutok na sa screen because of online learning. No, have screen breaks. Dapat lumalabas din kayo. Not na lumabas na mag-malling or whatever, but lumabas na bahay or just look outside from your window. Tingin kayo, get as much sun as you can. Have a proper diet, no junk foods, no sodas, ayan. And then we bond with our families, no? We talk to them. We try na we build our relationships. So, kumbaga, the world has given us another way to feel us, to make us feel loved, but actually it's made natural and available to us. Kailangan lang natin tingnan yun. Nandyan lang pala sila sa bahay. So, build a community, no, supportive community na alam mo na who takes care of you. Ayon.
This is also the question of the majority that needs to be addressed. What is the proper way of talking to someone who is experiencing mental health issues?
And I may add to it pala the previous question. Make it a point that you engage in self-care, no? Self-care, anything, like do things that you like, no? Yes. Lahat yun. Kung gusto nyo mag-malling, ano lang muna, hanap lang kayo ng ibang ways to do, to enjoy yourself. Pero yun, hanap talaga kayo ng bagay na makakapagpawala ng stress niyo. So, self-care, including pagkikipag-usap sa isang counselor, is a form of self-care. So, with that, yung question mo,
Okay.
So, we should not be dismissive, no? Na parang, okay lang yan, kaya mo yan, no? I understand that it's really true. Kakayanin talaga nila. Totoo yan. I mean, we have the innate capacity to do it. Pero, we have to first empathize, no? We have to be empathetic. We have to put ourselves in their shoes.
Yes.
Kasi, for some people, something may be easy, but for some, pwede na nandun na talaga sila sa pit ng experience nila. So, instead of dismissing them and saying, okay lang yan, ikain mo lang yan, itulog mo lang yan, just listen to them. And if you don't know what to say, pwedeng huwag ka lang talaga magsalita. Because
Makinig ka lang
sometimes,
po.
so sometimes yung mga words na lalabas natin might be, kumbaga, instead of helpful sa kanila, mas nakapa-feel pa sa kanila na frustrated or disappointed with themselves. So, if you don't know what to say, just listen, no? Just listen. And then maybe you could tell them, I don't know what to say at the moment, no? I feel that your problem is very difficult, that you're going through such a difficult time, but perhaps you could refer them to us. So just, be empathetic. Ayon.
This is the last question po. For students who are not capable to consult any mental health professional due to financial concerns, lahat po tayo, hindi mo broke na yun. Is there any way they can do this for free, or is there any organization or mental health advocate offering free consultation?
Okay. So always yung talaga, of course, we should put it in our heads that our mental health has to come first before any other concern, no? So kumbaga, our finances should not limit us to seek help. But if we are really in a situation na kailangan natin ng tulong and we don't have the means to pay, no? There are organizations and hotlines that we can contact na pwedeng magbigay sa atin ng tulong. We have NCMH hotlines. Pwede nyo siyang i-search. And then maybe you could go, if hindi nyo talaga siya makita, you could go to our web page pala, PLV Guidance and Counseling Center. And then pag nag-message kayo doon, may lalabas doon na automated na message. And nandun yung contact numbers ng NCMH. So, they are doing it for free. And if you want to go through counseling as well, there are counselors who do pro bono. So, sila yung okay lang sa kanila na free. And if you want to pay, because again, counseling is a form of self-care. No, we have to own it. We take responsibility doon. So, if you want to pay them, pero wala pa tayong means, pwede naman na after pa. No, after the sessions or after some time when we know na medyo nakakaluwag-luwag tayo. But always put in your head that finances should not be a hindrance for us to seek help. And also, we provide counseling dito sa Pamantasan. So make use of the resources that we have. We have counselors who are willing to listen to your concerns and willing to help you. So just go to our page, PLB Guidance and Counseling Center. Just message us your name, and dun yung mga instruction doon. And then may naka-assign na counselor for specific college and so on. So again, make it a point that you take care of yourselves by speaking to a counselor.
And on that note, thank you so much for joining us today, Mrs.
Sure.
Ma'am Lala. And I'm Myra Gamis, and this has been Myra Talk.